Ontario Health Coalition took to the streets in Toronto, Kingston, Sudbury, Thunder Bay and Windsor on September 27th, publicly calling on Premier Dalton McGuinty and federal politicians campaigning in the upcoming election to safeguard Ontario's public health care system. Members of the Registered Nurses Association of Ontario were meeting that day at a downtown hotel and made a point of venturing out to join other concerned citizens gathered at Toronto's Metro Hall for one of the rallies. The association's president, Wendy Fucile, spoke on behalf of all Ontario nurses, offering support not only for the call to stop privatization, but to also improve access to health care, particularly for those facing tough financial times.
It's wonderful to see so many friends here, and it is my very special privilege to speak to you today on behalf of RNAO, who is the voice of nursing in our province. All of the nurses here today, raise your hands. Everybody who knows a nurse, raise your hands. Everybody who's a friend of nursing, raise your hands. That's everybody. We have all come here on a Saturday morning, some of you from a great distance, to tell Premier McGuinty that a strong, public, single-tier, not-for-profit healthcare system is priority one for you and for your community. Nurses know that health and healthy communities are impossible, while more and more families and more children live under the shameful shroud of poverty. We are dismayed, indeed we should be shamed, that more than 1.7 million people live in poverty in Ontario. Their hopes for a better life were shattered last week when our Premier said, given the state of the economy, it may very well mean that we won't be able to move as quickly as we would have liked or as we had originally intended. In government, we have to act responsibly in the same way that our families do if finances get tight. Premier, poverty is a priority, and nurses from around this province are here today to tell you that there is no time to wait. The evidence is clear. Differences in social and economic status are directly linked to unequal health outcomes. Poverty, inadequate housing, social exclusion, barriers to health care are among the main social causes of ill health. We are acutely aware that our clients living in poverty struggle every day, every single day, to meet their basic needs for food and shelter. Academic research and our own practice confirms that poverty harms health and puts people at greater risk of death throughout their lives. Premier, we are here to demand that you deliver on your promise of leaving no one behind. The time for action is now. Start with the principle that a fair day's work equals a fair day's pay. Through minimum wage increases, stepped up enforcement of labor standards, and breaking down the barriers based on discrimination. Give adults and children real income security by bolstering the newly created Ontario Child Care Benefit and providing adequate support for those who cannot work full-time. Include policies that address the disproportionate effect of poverty on Aboriginal people, women, persons with disabilities, racialized communities, and newcomers to our country. Make affordable housing and quality child care top priorities, and ensure that every one of us has real access to medical and dental care. Premier McGuinty, we look to you for leadership to deliver and implement now, a comprehensive poverty strategy. And there's one more thing, Mr. Premier. You may have noticed that there's a federal election going on. It is the people who live in poverty who need a champion to make sure poverty and health are part of that federal election debate. They are the people who really need equalization. Premier McGuinty, we need you to stand up for Ontarians living in poverty here in Ontario. hold to the fire the feet of every federal candidate. And to all of you, my friends, I say, vote on October 14th, but vote for health, healthy communities, and strong, public, one-tier, not-for-profit health care.